Well, we're here with Dr. Stevens, Dr. Roger Stevens, a dentist in Manhattan, Kansas. There is a Manhattan in Kansas. Unbelievable. How are you doing, Dr. Stevens?
I'm doing fine here in the Little Apple of Kansas. Yes.
In the Little Apple of Kansas. So you, all right.
We're not the Big Apple. We're the Little Apple of Manhattan, Kansas.
Yeah, well, okay. How many people do you have living in the Little Apple?
The permanent residence is about 50,000 people. We also have Kansas State University here, which is over 20,000 students.
Got it. You have a college town, huh? All right.
Yes, it's wonderful.
Lots of fun. Can never get old in a town like that, right? All right.
There's a lot of activities to keep you youthful or wishing you were youthful.
Well, Dr. Stevens, tell me, what is kind of the philosophy of you and or your dental practice? Because not all dental practices are equal. That doesn't mean one is better than the other one necessarily. They just have a different emphasis. Tell us a little bit your philosophy, your emphasis. What can a patient expect? Which type of people should come to you? And maybe, if you have time, tell us even what made you wanting to become a dentist.
Well, I don't know, the second question first. I don't know why I became a dentist. I had a choice coming out of college whether to go into marine biology or dentistry, and I get seasick a little bit, so I decided on dentistry. So I went to school in Chicago at Loyola University and just fell in love with the profession. The philosophy of our practice here is we love patients of all ages, sizes, anybody, but our practice philosophy is to get people well and then prevent other dental disease and dental problems from occurring. So when we see patients of all ages, we like to get them healthy, correct any dental problems, decay, gum disease, any missing teeth, and then get them into optimum shape and then maintain and keep them there just like a fine-tuned automobile.
So, and I have heard that, especially in dentistry, it is true with literally everything from a car to, of course, normal health in, the normal body. But dentistry very specifically, that further problem can very, very much be prevented as scientifically and as predictable as more than any other healthcare branch can predict. I mean, to predict a stomach ulcer, there are certain things you can do, but they're not as 100% as to predict a tooth loss, for instance. Simply, you guys have it more under control in that field of things. So basically what you're doing is make sure that whatever problem a person has, it gets restricted, that it doesn't get worse, and hopefully, which is another thing you guys can do, put it back to perfect shape.
Absolutely. We want to try to correct any problems and make people's mouths healthy, beautiful, and to work well and be comfortable.
You said you're going to see people from all ages, all sizes. Does that mean you do pretty much all dentistry under one roof, such as are you doing orthodontic or Invisalign? Are you doing periodontal disease? Are you doing, pulling wisdom teeth? Are you doing this type of things? Are you doing veneers? Are you doing implants, dental implants?
We try to do all the services for our patients. There are certain things and certain times when a specialist is necessary. Specialists have their specific role in if they're particularly difficult cases, and a difficult orthodontic case, a difficult periodontal case, a difficult surgical case. You want an expert doing those things that a general practice doesn't have particularly specialized skills to do.
Right.
I would want a neurosurgeon to operate on my brain, not my family physician. But we do try to keep all of the things that we can competently and properly perform and provide. We like to do it here for our patients.
Sure. And I'm sure they appreciate both. Number one, that they get, because I'm sure most people, I don't know what the percentage might be, let's say 95 or whatever, they qualify that, their case isn't so difficult and you can do it. So I think they appreciate that they don't have to run around in circles and one guy is, so to say, fixing it all and doesn't blame there's something going wrong on the other guy. And at the same time, they probably appreciate that you are ethically enough that if it's above your head, if it's better for the patient that somebody does it, who that's all he does, that they get sent out. Well, thank you very much, Dr. Stevens. Is there anything you care to say or ask before I end off?
No, thank you very much.
Wonderful.
Have a great, healthy smile.
Thank you very much.